We are now going to look at Chapter 24, Digestive System Infections. Digestive system infections are usually transmitted in contaminated food and water. It is usually by the fecal-oral route, which can be minimized by proper sewage disposal, disinfection of drinking water, and proper food preparation and storage. 1 in 6 people are infected with a foodborne illness every year in the U.S. Most have mild symptoms and go unreported, and most digestive system infections have a symptom of diarrhea. Sometimes diarrhea can be life-threatening. It absolutely can cause a fluid imbalance, excessive dehydration, but sometimes when you medicate to stop diarrhea, it can be counterproductive. Sometimes your body wants to flush out what is making it sick. It knows that it needs to have diarrhea to get rid of something within your body. And sometimes if you medicate and stop it from being able to flush it out, that can cause more problems than good sometimes. But yes, if you have excessive diarrhea that does not stop, that you're becoming dehydrated, that your electrolytes are getting out of balance, yes, then you would need to medicate for diarrhea. Digestive system infections are more common in developing countries. The World Health Organization estimates that poor sanitation, poor sewage control causes 2.5 billion cases per year of diarrhea in children under the age of 5 years old. And this contributes to 1.5 million child deaths per year. Diarrhea can be very serious in children and in older adults. It is something that needs to be monitored. The United Nations estimates that half of world hospitalizations results from poor sanitation and sewage control. If you have not had anatomy and physiology, this is an image of the digestive system. When we think about the digestive system in microbiology, we think of it as a big circle, even though it looks like a big, long tube. Food goes in your mouth, it winds around, it goes down your esophagus, goes to your stomach, it goes from your stomach to your small intestines, winds around, goes to the large intestines, goes to your rectum and out your anus. And it's kind of a consistent route. We think of it in terms of a circle because of the fecal-oral contamination. When you put things in your mouth, they can be contaminated with feces, which can lead to infection. Maybe you picked it up from something, a contaminated object. Maybe the person who handled your food had something on their hands and it was transferred to the food. There's many reasons why it's a circle, and we consider it to be a fecal-oral route. We have talked about the normal microbiota a number of times in this class, and I will continue to talk about how important it is to have a very healthy normal microbiome. And if you think back to those images of where our healthy normal microbiome is located, it's located all over our body and within our body. Our mouth has over 700 different species of microorganisms that contribute to a normal microbiota. Only half of these have been identified and given a name. We have tremendously large populations of bacteria in our large intestines. We need healthy flora, and we need a diverse healthy flora. It can influence many things in our lives. It even can drive mood or cravings. It can contribute to anxiety, cognition. It contributes to pain. We rely on our bacteria for finishing digestion. Our healthy normal microbiome is very important. I really like this photo. There was another one that I saw that was really cool as well. I like that it shows that you are just covered in a lot of microorganisms, and your tongue and your oral cavity have a large amount of beneficial microorganisms. Remember, very few microorganisms contribute to disease. The vast majority are beneficial to us. But yes, they can become opportunistic, but we need to feed our normal microbiome and keep it healthy and take care of ourselves with good nutrition, and it will do us well. An important anatomical difference that we need to talk about is that teeth do not shed their surface. This is unlike any other body surface. Because teeth do not shed their surface, things can accumulate on the surface of our teeth. And because we have so many different types of microorganisms in our mouths, sometimes these microorganisms can form biofilms. Remember, there are all kinds of different microorganisms in our mouth. Bacteria and archaea, viruses, even protozoa and fungi can be in our mouth and can form biofilms. Initially, when biofilms form in our mouths, they're kind of like a protective layer for our teeth. They can protect the teeth from acid. We have a lot of things that we ingest that is acidic, and that can erode our enamel. So initially, when a biofilm forms, it's trying to protect our teeth. But again, these biofilms can get out of control, and they can contribute to tartar buildup. Tartar and plaque are buildups of these biofilms that have formed. Dental caries is tooth decay as a result of microorganisms' metabolism of sugars. Our diets have evolved over the years and unfortunately are very heavy in carbohydrates and sugars. Reaction breakdown to carbohydrates forms lactic acid, and again, that lactic acid can dissolve your tooth enamel and contribute to dental caries or cavities. We do not replenish the surface of our teeth. We have to take care of our teeth. We have to take care of them in the long term. This is an image of a tooth. You can see that it has a visible crown with an outer layer of enamel, and that enamel can be affected by the things that we ingest, from sugars to lemonade to anything that could be acidic, like spaghetti, tomato sauce, things like that. They are affected by the things that we eat. There is a layer of dentin and a layer of inner pulp. There's a root, and we have gums that we need to take care of. All of these structures of the teeth we need to pay attention to. So we need to take good care of our teeth so that we can have them for all of our lives. You need to brush your teeth. You need to floss your teeth. There's many different things that we need to do. So again, we need to think about the biofilms that form in our mouths and on our teeth. Initially, when they form, they start to form because they're trying to protect the teeth. But then they can get out of control and they themselves can start to produce acids and contribute to the decay that's occurring in your teeth. Unfortunately, this decay can get deeply through the tooth, and tooth decay can be very, very painful. You need to have your cavities treated. If a cavity continues, it can get down into your root, and oftentimes it can totally degrade the tooth and you have to have your teeth pulled. There's many reasons why we need to go to the dentist, and one of them is to make sure that we can keep our teeth healthy. Yes, dental care is very, very expensive, but I'm going to talk about how poor oral hygiene can contribute to many different things in our lives in this chapter, not just to tooth decay, but we do need to be very, very aware of what is happening and if decay starts in our teeth so that it does not become a deep cavity. Surface caries are most common in early childhood. Let's look at the images below. In image A, that is tartar buildup that has formed from a biofilm that has gotten out of control. You can see a little bit of decay occurring in the image B. In C, that is a tooth x-ray, and the dark areas represent decay within the tooth. In D, you can see that there is damage and it's going deep into the crown. In E, you will see that you have to remove all of the decay that is occurring in the tooth before you can put a filling into that tooth. If you don't remove all of the decay, it can continue. That's why they drill the teeth really well before they put a filling in. We also need to be concerned about our gum line because our gums can recede as we age. It's much more common to have dental caries that can occur deep below the gum line, and gingival recession is a very serious concern, not just for dental caries, but it can cause the loosening of teeth and it can cause a lot of other complications, more access for bacteria, and I'm going to talk more about that. Tooth decay has greatly accelerated over the last 200 years. The presence of tooth decay and the presence of tooth loss has dramatically increased over the last 200 years. When human remains are retrieved from archaeological digs and they look at the skulls of the human remains that they find, all of these skulls have their teeth. The diet many, many years ago is not the same as what we have today. The changes in our diet, the increase in sugar consumption absolutely contributes to this dramatic rise in tooth decay. Also, access to care is more limited. It is very costly to see the dentist, and socioeconomic reasons prevent people from going to the dentist. Most people do not have dental insurance. When we look at the things that contribute to tooth decay, absolutely it's sugar. But when we look at the pathogen itself is generally thought to be Streptococcus mutans. That is the primary pathogen that causes tooth decay. In my graduate studies, I have done a lot of research, though, on different types of bacteria that can cause tooth decay. And one of the bacteria that can cause the most severe complications, not just in tooth decay, but in systemic infections, is Porphyromonas gingivalis. And that is something that is very important to consider. These bacteria and these microorganisms that can cause tooth decay can also go deeper within our systems and cause extensive infections, which I'm going to talk about in the next slide. When we talk about preventing tooth decay, we must brush and floss our teeth. Most people say they floss if they go to the dentist and their dental hygienist asks them, but most people do not floss. We need to brush our teeth at least 2 times a day. And thinking back to flossing is so important because it can massage the gum line. Remember, I talked about how the gums can recede as we age, and flossing can help to keep that gum line strong. Bleeding that occurs from not flossing and from not well cared for gums can cause it to be a portal of entry for these microorganisms to spread without the body. Let's talk about fluoride. Fluoride can help the enamel resist the effects of acid. In a lot of areas, fluoride is in the water. Often, in some places, fluoride is naturally occurring in the water. But we do not have fluoride in the Portland area due to a vote of the people. But fluoride can really help to make teeth stronger. And again, it is helpful in resisting the effects of acid on our teeth, and fluoride is considered to be antimicrobial. Teeth can also actually be helped by chewing gum. The ADA talks about how gum can increase the flow of saliva. When you chew sugarless gum, it can help to reduce the plaque acid. It gives strength to your jaw. There's a German company that called BASF, and they have developed a special chemical using lactobacillus, which is a probiotic. They've used it to form something called Pro-T-Action. And they have found that when they add this to gum, they have found that it can bind to Streptococcus mutans and reduce dental caries by 27%. They have been doing clinical trials for quite a while now, so I know they're still working on developing this gum, and hopefully it will come to the market in the future. Those who are at an increased risk for complications from things that are occurring in our mouths, in our oral cavity, are those who have poor oral hygiene. They don't brush their teeth. They don't massage their gums with dental floss. They can also have chronic conditions like diabetes, or can have a autoimmune disease that makes them immunocompromised and more at risk for infections to spread from the mouth throughout the body. Those who use tobacco, all forms of tobacco, especially those who use chewing tobacco, can cause a number of things to occur within the mouth, not just cancer, but very serious inflammation and infections can occur from tobacco use. Also, genetics have been found to play into good, healthy oral cavities. sometimes our genetics can be affected by our parents, and sometimes that means that our teeth will not be as strong and healthy as they might be. Malnutrition can occur due to poor oral hygiene, because if you lose your teeth and you are not able to eat a variety of foods, it can contribute to malnutrition. You do not have the teeth because they've fallen out from decay or they've had to be removed due to decay. You need to have good, healthy teeth so you can have good nutrition to contribute to the health of your body. Now, I mentioned how if you have bleeding gums, and even if you don't, sometimes microorganisms can get from the mouth to spread throughout the body and can cause inflammation and infections. But blood absolutely is a portal of entry for these microorganisms. It has been found that those who do not floss their teeth and those who have poor oral hygiene are more at risk for cardiovascular disease, endocarditis, and valve problems can occur due to poor oral hygiene. Cancer, again, is a very serious concern due to poor oral hygiene and things like tobacco use. We need to have a healthy mouth and a healthy body so that we can take care of everything from nutrition to preventing infections. Okay, let's shift gears. Let's talk about Candida albicans. Candida albicans is a yeast. Remember, yeasts are fungi. They can contribute to a healthy, normal microbiome, but they can also become opportunistic and they can overgrow and cause infections. Infections can occur from Candida albicans like oral thrush, and that can occur in infants and immunocompromised adults, especially patients who have AIDS. Can often have reoccurring infections of Candida albicans and oral thrush within their mouths. Oral thrush and infections caused by yeast, Candida albicans, are treated with antifungals. Again, it is part of our normal microbiome, but it can become opportunistic and can contribute to infection. This is an image of oral thrush that can occur in the mouth. It's caused by Candida albicans, and you can see those white patches. Those white patches can continue to grow, though, and form a fibrous growth, like a pseudomembrane. We talked about the pseudomembrane before that can grow from an individual who is infected with diphtheria. And that pseudomembrane, if something grows in your oral cavity, especially towards the back of your throat, remember that can restrict the airway and can become very, very serious. Oftentimes, oral thrush is called the disease of the disease because those who develop oral thrush often have serious compromised immune systems. They may be on chemotherapy. Again, they may have HIV or AIDS. And oral thrush is an infection that can go systemic and cause other serious infections throughout the body. Mumps is included in the digestive system chapter because it's due to a viral infection of the parotid gland. A parotid gland that you have produces saliva. It's part of the salivary glands. It can become infected with a virus that is transmitted through respiratory droplets or saliva. Mumps is on the rise because of the decrease in vaccinations that has been occurring over the years, but it is very preventable with the MMR vaccine. That is a combined vaccine for measles, mumps, and rubella. But this is a preventable viral infection. Symptoms of mumps include that really swollen parotid gland that can occur, that is being shown in this image. You can have a high fever. You can have pain associated with those swollen, inflamed parotid glands. You can have a severe headache. This is not a treatable infection because it's a virus, and acyclovir does not work for mumps, as it doesn't for many viral infections. The treatment here is supportive care. You need to encourage rest. You need to encourage hydration. And it takes time to get over a viral infection like the mumps. Food poisoning in general is often mild and unreported. It can just be like you feel after you ate, you have like a stomach ache, you might have a little bit of diarrhea, but it can also become severe. Food poisoning can be caused by multiple species of bacteria, and we are going to talk about a few of them. These bacteria will produce toxins. They can be exotoxins, endotoxins, and enterotoxins. Those that produce these toxins usually cause the most severe cases of food poisoning. Again, in some circumstances, food poisoning can lead to life-threatening organ failure. This is an image of Staphylococcus aureus, which is a cause of many different types of foodborne illnesses, which we are going to talk about. Food poisoning that occurs due to Staphylococcus aureus is often the result of poor hand hygiene by those who are preparing and storing the food that you are consuming. Diarrhea can result very rapidly. It has a very fast onset, and you usually know what you ate that caused that diarrhea. It usually occurs from 1 to 6 hours after ingesting the contaminated food. It has an enterotoxin, and this enterotoxin is a super antigen. What happens with these super antigens is they can elicit responses from your many different types of immune cells, especially the T cells. There's an excessive activation of your immune response. And then there will be an excessive, massive cytokine release that leads to an increase in inflammation. And this happens very rapidly when it's due to staphylococcal types of food poisoning. Usually the diarrhea occurs rapidly, and it will often clear the system pretty quickly. Often it will resolve in 24 to 48 hours. Salmonella also can cause food poisoning types of infections. Salmonella has the ability to survive in the phagosomes or your macrophages. Your immune system has a more difficult time ridding the body of this type of a foodborne infection. It can enter into the intestinal epithelium and trigger an immune response with inflammation and a hypersecretion of fluids and excessive diarrhea. It is not rapid like Staph aureus. Infections that are caused from salmonella often can occur 6 hours after being infected or up to 4 days after eating something that has salmonella in it that has caused a foodborne infection. Salmonella enterica, serotype typhimurium, or typhoid fever. You might have heard of that, and we're going to talk more about typhoid fever in the next few slides. It can also be Salmonella bongori that causes these food poisoning types of infections. They can be fatal, and mortality is due to septic shock caused by the endotoxin that Salmonella has. There is a higher mortality in infants and older adults. Remember, those who are more at risk. Salmonella will invade that intestinal epithelium and it will get into the mucosa. Oftentimes, it can pass through the mucosa and get into the circulatory system. If the infection gets into the circulatory system, it can cause a systemic response, systemic infections, and can lead to sepsis. Symptoms of Salmonella food poisoning include fever, diarrhea, nausea, and vomiting. Like food poisoning infections that are caused from Staph aureus, those that are caused by Salmonella are often underreported. But for the reported cases, there are generally about 1.2 million that occur in the U.S. per year. And there's 23,000 hospitalizations and 450 deaths have occurred per year from Salmonella food poisoning. It is from a variety of things. You can pick up Salmonella from these various things. It is found in undercooked meat or seafood. It is also found in eggs, egg products, in poultry like chicken. It's found in shellfish, and absolutely Salmonella can be found in raw meat. You need to cook your eggs, you need to cook your meat to the appropriate temperature, which we're going to talk about in a little while. Salmonella can also be found on sprouts, and also it can be found in some vegetables. Whenever I go to the deli and I have the option for sprouts, which I love, I always refuse them because I know that Salmonella has been found in many types of commercially grown sprouts. If you grow your own sprouts, you need to be very, very careful with them and make sure that you grow them properly and that you make sure that they're clean when you use them. Salmonella can also be found in turtles and lizards. So if you have a pet turtle or a lizard and you play with that turtle or lizard, you need to wash your hands. After playing with them or cleaning their little habitat, you need to make sure that you clean your hands well because Salmonella can be transmitted from turtles and lizards. It can also be found in petting zoos and fairs, so you need to make sure that you wash your hands and use hand sanitizer if you are playing with the animals at petting zoos or fairs. Also, it's really important when you prepare your food that you use different types of cutting boards for the different types of things you are preparing. You need to have a cutting board that's just for chicken so that you can make sure that it's completely cleaned properly and you are not cutting vegetables on the cutting board after you prepare your chicken. You need to have different types of cutting boards and they need to be properly cleaned so that you can remove the potential for Salmonella food poisoning. I thought this was a really cool chicken image. And you can see that a chicken has what's called a cloaca. And this cloaca is a multi-purpose hole. Many different things can come out of a cloaca, including waste products, including chicken eggs. When you have backyard chickens and you have eggs from backyard chickens, you need to make sure that you clean them. You also need to make sure that you're taking good care of your backyard chickens. And you absolutely need to be aware that salmonella can get inside the egg as it forms because of just its proximity to many different anatomical structures. And also, salmonella can get on the egg when it comes out or when the chicken is sitting on the eggs. Fresh eggs from a chicken are great, but you absolutely need to be careful when you are enjoying those fresh eggs from your backyard chicken. Salmonella enterica serotype typhi causes typhoid fever. It is transmitted from human to human. It is transmitted through the fecal-oral route. It can also be from contaminated sewage, poor sanitation. It's found in feces. It can also be expressed from your hands if you are a carrier. It can also be on your hands and you can transmit it that way. The bacteria can spread through the body in phagocytes. And when these phagocytes lyse, they can spread to the bloodstream and they can spread throughout the lymph system. When typhoid fever can spread throughout the body systems like that, it can cause very serious complications, and it can be fatal. 1 to 3% of recovering patients can become carriers, and they can harbor salmonella in their gallbladder. Typhoid Mary, who I'm going to show you a picture of and talk about on the next slide, was a carrier for typhoid fever. She did not have the symptoms of typhoid fever. She probably had a mild case and she thought that she recovered. Maybe she didn't know she had it, and she became a carrier and infected a lot of people, which I'm going to talk about. Worldwide, 300 to 500 annual cases still are occurring of typhoid fever. 70% are acquired after international travel. Typhoid fever is more prevalent in developing countries. And again, it can be fatal. Because this is a bacteria, it can be treated. It can be treated with antibiotics. This is an image of Typhoid Mary, who I talked about on the previous slide. She was a carrier of typhoid fever, and she was a cook. And she was found to infect a number of people. And when it was traced back to her, she was told to stop cooking to find another position that she could do for work, and she needed to stop cooking because she was spreading typhoid fever to a number of people, some who died from being infected from the food that she cooked. But she would not stop cooking, and despite being told numerous times and refusing to stop because she felt that she did not have it, she was put into basically a ward where patients were that had typhoid fever, and she was basically a prisoner in this typhoid fever ward because she refused to stop cooking food and spreading this infection. And that was one way that they were able to contain the infection from her. Food poisoning caused from E. coli or gastroenteritis caused from E. coli can have symptoms that range from mild to possibly life-threatening diarrhea. The number one cause of travelers' diarrhea is E. coli. We're in other countries and we're eating new and exotic foods. We're drinking water that we're not used to. All of these things are new to our system, and we're not able to fight off a little bit of diarrhea that might occur from the ingestion of this type of E. coli that we might find in other countries, and so they call it traveler's diarrhea. Life-threatening diarrhea can occur from enterohemorrhagic strains or enteropathogenic strains of E. coli. In 2011, there was an outbreak in Germany where hundreds of people were infected and there were many fatalities, and it was a brand new strain of E. coli that had evolved. When we talk about enterohemorrhagic strains like O157H7, these can produce Shiga-like toxins, and they're the most dangerous. These are the types that can cause epidemics. The O, when we look at these numbers and these letters, the O is the cell wall antigen. It's that LPS endotoxin. And as you know, when we talk about the endotoxin, when it's released to the body, it can cause extensive damage and it can even lead to sepsis. So this can cause fatalities. The H refers to the flagella, and it refers to the antigen that's occurring on the flagella. 50% of feedlot cattle have enterohemorrhagic strains in their GI tracts. So if you are eating organic beef because you feel that organic beef is something that you want to eat or feed your family, a lot of this organic meat will have enterohemorrhagic E. coli in it. When that cattle that is used for beef is slaughtered, it will still have the E. coli in it and will cause very bloody diarrhea. You have to cook your meat to a specific temperature. Please do not eat raw meat, and please cook your meat so that you can cook out the E. coli that can cause a very serious infection. This is a really cool image because on the left you can see E. coli, and on the right you can see O157H7, which is that enterohemorrhagic strain of E. coli that can cause very serious infections. It has these little curly fibers that are identified, and these little curly fibers can help the E. coli to attach to things. It helps the bacteria to attach to the mucous membranes of your intestines. It can help it to attach to surfaces. If you're thinking about the fecal-oral route and people who don't wash their hands, they can transfer this O157H7 from feces that are on their hands to surfaces, and those little curly fibers will help that E. coli to stick to those surfaces. Those little curly fibers can also help the E. coli to form biofilms. And as you know, biofilms are resistant to disinfectants and to antibiotics. So these little curly fibers that the O157H7 have is definitely a virulence factor for this bacteria. Symptoms that can occur from foodborne illnesses that are caused by E. coli include abdominal cramps and diarrhea. Because it can be caused from O157H7, which is a hemorrhagic type of E. coli, it can cause bloody diarrhea, and this is very serious. It can also cause very watery diarrhea. You can have vomiting, you can have a high fever, you can have chills that are related to the fever. If this infection continues, it can affect the kidneys and cause complications to occur within the kidneys, especially in small children and those who are immunocompromised, and also in older adults. Remember, those are the ones who are most at risk when they are infected. The onset is usually 2 to 8 days after exposure. Usually after 3 to 4 days, symptoms will begin, but it can take up to 8 days. So often when there is an outbreak from E. coli, say there is a romaine lettuce outbreak that has E. coli that is causing foodborne illnesses to occur, it is often difficult to trace back to the source because people can't remember what they ate 8 days ago. I mean, it's very hard to remember what you ate a couple days ago. So sometimes it's very hard to trace back these outbreaks, and it often can take a while for them to realize where the source of an outbreak of E. coli is coming from. That's why oftentimes you'll hear about, oh, don't eat a particular salad that has this expiration date, which was a while ago, and so you probably already ate it. They can ultimately find the source, and then oftentimes they'll remove all the packages of salad or all the romaine lettuce that is in the stores so that they can stop the spread of this particular infection-causing bacteria. Treatment for most patients, they can recover on their own. They need supportive care. You need fluids. You must replace your fluids so that you can be hydrated and not have an electrolyte imbalance. Antibiotics often are not effective due to increasing antibiotic resistance that is occurring with E. coli. Prevention of infections from E. coli is a pretty reasonable thing that you can do. Do not eat raw or rare meat. You need to cook it to a certain temperature, and I will talk about storage temperatures and cooking temperatures on the next slide. Do not eat raw or rare meat. Some people really enjoy it, but you are at risk of developing an infection from the bacteria. You should avoid non-pasteurized beverages like milk or cider. When you go to a farm stand in the fall and you purchase their cider, make sure that you're careful and check to see if it's pasteurized, because that will have removed the E. coli that might have been present. You need to wash your fruits and vegetables because you don't know how they were grown, and you don't know if there is something that is in the dirt, or there's something that was used to fertilize the fruits and vegetables with. You need to make sure you wash your fruits and vegetables. So if you're a vegetarian or a vegan, you are still at risk for developing E. coli infections because it can be found on fruits and vegetables, as is often seen in the lettuce products that we buy in the stores. You need to wash your hands before and after preparing your food. Washing your hands is so important, and yes, you have to wash them for 20 seconds. You need to cook all of your foods. You know, when we're kids, we want to eat the cookie dough, and it used to be, oh no, you can't eat the cookie dough because there's eggs in it because of salmonella. But also, there can be E. coli in the flour. In many recipes now, you will see that people will cook the flour or bake it in the oven for certain recipes that require the use of flour. not just in cookie recipes, but for other recipes. Flour can be contaminated with E. coli, and you need to cook it out. You need to encourage children to have good hand hygiene. After they go to the bathroom, they need to be helped to wash their hands appropriately so they don't spread bacteria to surfaces that you are going to pick up or other people will pick up. Proper food preparation and storage is essential. You need different cutting boards. You need to clean cutting boards. You need to store them properly. You don't want your drippy, bloody meats over your fruits and vegetables. You need to think about how you are preparing your food and storing your food, as well as cooking and washing and all of these things to prevent infection from E. coli. I love this image that comes from your textbook, and it shows the importance of cooking your food to the proper temperature so that you can make sure that it's safe for consumption. I also like how it talks about the refrigerator and the freezer temperatures and shows you where that danger zone is, where bacteria can grow and replicate and can ultimately cause an infection in you. So please make sure that you are cooking your foods to the proper temperature. Yes, we have talked about how there are things out there, microorganisms and endospores, that cooking may have an effect on those or may encourage the growth of those things. But this is a general image that can show you the importance of cooking your food and storing your food properly to reduce the growth of bacteria and the increase of the possibility of foodborne infections. Cholera toxins that are released from certain serotypes of Vibrio cholera can cause excessive diarrhea that is so watery and profuse that it's sometimes called rice water stool. These toxins cause the host cells to secrete chloride ions, HCO3 and H2O, causing severe diarrhea and dehydration. You have to quickly replace fluids. There can be such excessive dehydration from this overly watery diarrhea that the skin can even turn blue. Cholera can disseminate throughout the body and cause very serious infections that can range from necrotizing fasciitis to fatalities from these severe infections that can occur. It is often due to poor sanitation and sewage control. It is found in contaminated food and in contaminated water. Natural disasters can also see a rise in Vibrio cholera that can cause excessive diarrhea and very serious infections. You can imagine with floodwaters and hurricanes and tornadoes that there can be a growth and rise in Vibrio cholera. Also, when we think about seafood and shellfish, crustaceans like oysters or crab or lobsters, these are filter feeders. And if they're in contaminated water and you eat them without cooking them, you will ingest these Vibrio cholera and can cause very serious infections. There have been numerous infections occurring in particular areas in Florida where people who have ate contaminated seafood or oysters raw have died from eating these shellfish and crustaceans because of this Vibrio cholera. the treatment for infections is supportive care. Unfortunately, there is not a good treatment for cholera. You need rehydration, and you absolutely need electrolyte replacement. Helicobacter pylori, or H. pylori, has been linked to peptic ulcers of the stomach and the duodenum. There's also an increased risk of stomach cancer from infections by H. pylori and also from peptic ulcers that go untreated. The H. pylori can burrow deep into the mucous membranes, and we'll look at that on the next slide. What's interesting about H. pylori is it can tolerate the high levels of acid in the stomach. And even when these levels of acid increase due to things like stress, which is often thought to cause peptic ulcers, the bacteria will continue to grow and thrive. They're able to produce urease, which can convert urea to ammonia. Then they use this ammonia to neutralize the stomach acid. And then they're able to create an alkaline environment in which they can thrive. These H. pylori damage the tissue. They can cause the death of the tissue in the areas that they are burrowing into. They can cause an increase of inflammation to the area. The immune system is trying to react, and so there will be increasing inflammation that occurs due to this burrowing of the H. pylori. There's an interesting test that can be done. It's called a breath test that they often use to check for H. pylori, and they can check the expirations from an individual, someone breathing out, and they can see if they can identify a breakdown of urease that is occurring from the H. pylori that might be present. This is an image from your textbook that shows that H. pylori bacteria burrowing its way down into the mucous membranes. When it does this, in addition to causing these ulcers that can occur in the mucous membranes, it decreases the production of the protective mucus that is within these membranes, and you can have very severe abdominal pain occurring from these peptic ulcers. This is another image of a peptic ulcer that is occurring in the stomach, and also it's showing that H. pylori bacteria. And it has a good number of flagella, so it's able to work its way down deep into those mucous membranes. There is a treatment for peptic ulcers caused by H. pylori. It is treatable with antibiotics. It's often treated as a triple therapy, which is a combination of medications in addition to that antibiotic. They will use acid-reducing types of medication in addition to the antibiotic to reduce the acid level, because that H. pylori likes that acid level, and so if they reduce it in addition to taking antibiotics, you can treat H. pylori infections. Usually, the peptic ulcers will disappear after effective treatment. But there is growing evidence that H. pylori is developing resistance, so we need to think about alternative treatments besides the use of antibiotics and this triple therapy that can be used. Different types of treatments that can be used in addition to triple therapy are dietary treatments. Sometimes you will need to change the way you are eating. Again, you need to eat a variety of different things to have good nutrition. You need to eat a healthy diet. They have said that H. pylori can be affected by green tea or honey or broccoli sprouts that you grow yourself so that you don't have additional bacteria from the sprouts. Probiotics have also been very helpful for peptic ulcers that are caused by H. pylori, because probiotics can help you to have a very strong normal microbiome, remember, and that can also be beneficial for eliminating H. pylori. Also, the use of phototherapy or ultraviolet light has been used in the treatment of H. pylori. Stress reduction is very, very important. A reduction in smoking is also important to reduce the incidence of peptic ulcers occurring from H. pylori. Getting enough sleep, having a good sleep schedule, having good sleep hygiene can do a lot for helping to reduce your stress and to having a healthy well-being overall. It really can contribute to your well-being. You need to get your rest. Clostridium difficile, or C. diff, is often nosocomial or a secondary complication of previous antibiotic therapy. Remember, when you use extensive antibiotic treatments, you can destroy your normal microbiota. You are disrupting your normal flora because these antibiotics will kill a wide variety of bacteria. When you do this, you are putting an individual at risk for C. diff, and those who are most at risk are older adults and those who are immunocompromised. There is a high mortality in older adults from C. diff, and it's very difficult to treat in older adults. The bacteria have endospores. The bacteria is chemically resistant, so it's difficult to treat, and it can become opportunistic. Symptoms can range from mild diarrhea to life-threatening colitis. It can cause necrosis of the colon. Because this is a more resistant type of bacteria, and because of the endospores that are present, and because this can be caused from antibiotic therapy, alternative treatments have been developed, including fecal transplants. Now, fecal transplants might seem a little bit strange, but they have had a 90% success rate in the treatment of C. diff. So a fecal transplant can help restore the normal microbiota of an individual who is infected with C. diff. You take the healthy donor stool and you mix it with saline, and then you can transplant this fecal matter via an enema into the infected patient. And again, it's had a 90% success rate in treating C. diff. So even though it does sound a little bit strange, it is really a good treatment for C. diff. Here is an image of how C. diff works on the mucous membranes. So it can colonize these mucous membranes when the microbiota is disrupted. If you get rid of normal flora by extensive antibiotic use, then C. diff has a place to colonize. And when it does, it has these toxins that can trigger an immune response. It can trigger extensive inflammation, and it can cause necrosis to occur in these mucous membrane layers. It can also develop a fibrous buildup like that pseudomembrane to occur on these mucous membranes. There are other bacteria that can cause foodborne illnesses and gastroenteritis. Yersinia is one that has many different species that can cause gastroenteritis. You might know about Yersinia because of the plague, but this is specific to gastroenteritis, and these are specific species that can cause that. It's usually transmitted in meat and milk. All of these bacteria are usually caused from contaminated food or water, or that fecal oral route plays a major part. When we look at Clostridium perfringens, remember that causes gangrene. And it can grow in the GI tract. And if you can imagine the bacteria that can cause gangrene, what it can do to the GI tract. And it produces an exotoxin, which causes additional complications. Bacillus cereus, we have talked about that before. It has an endospore. When you ingest Bacillus cereus, it has an emetic and an enterotoxin, which can produce mild symptoms, severe symptoms, or it can be fatal. We've talked about how they can form in rice or in pasta. They can, if you do not properly refrigerate your rice or pasta, then these endospores can develop, and when you heat it, they can erupt, come back to life, and that Bacillus cereus can make you very, very sick. Norovirus is a positive stranded RNA virus. If you look back, you may remember that positive stranded RNA viruses are those that cause infections the fastest. They replicate and produce more viruses very quickly. Norovirus is highly contagious, and we're going to talk about it on the next slides. Norovirus can cause acute gastroenteritis or excessive diarrhea. Symptoms can include abdominal pain, nausea, diarrhea, vomiting. Sometimes you can have a fever, headache, myalgia. Those are those muscle pains again. It is usually sudden onset because it is that positive stranded RNA virus, and usually it lasts for a short period of time. The annual cases per year can be up to 21 million cases of norovirus a year. There is an estimation of 70,000 hospitalizations, and 800 deaths have been on record for norovirus within a year. Again, norovirus is a highly communicable infection. It has a very low ID50 of 18 viral particles that are needed to cause an infection. That's very low. And these viral particles can survive on dry surfaces and objects for up to 2 weeks. Transmission can also be via ingestion of aerosolized droplets. You can walk into a bathroom where someone has gone to the bathroom and flushed the toilet, and these particles have gone into the air and they're lingering, and you can ingest them and be infected with norovirus. Because it can survive on dry surfaces, people who touch these contaminate surfaces via the fecal oral transmission route, you can pick up this infection and be infected by this transmission route. You can also be infected because norovirus can move through air ducts and HVAC systems and has been found to spread in places where people are closely together. They live in closely confined areas, like in long-term care facilities. There have been outbreaks of norovirus. There have been outbreaks on cruise ships of norovirus, and it takes extensive cleaning in order to decontaminate these surfaces. Prevention of norovirus includes hand washing for 20 seconds. Hand washing is the key to so many prevention methods for many infections. Isolation can be important. Cleaning surfaces very well. Proper hand hygiene, proper hygiene and food prep. You need to have the proper food preparation techniques so you're not transferring fecal matter to the food in order to transmit this virus. People can be reinfected with norovirus because this is such a fast virus in occurring and also resolving. The immune system does not have the ability to recognize it that quickly and retain a memory of that particular norovirus, so you can be reinfected with norovirus. Treatment is self-limiting. It's rest and hydration. You must replace fluids when you have diarrhea. Avoid antibiotics. This is a virus, so we don't take antibiotics. We are going to talk briefly about hepatitis here. You have a homework question that you can get more information about hepatitis on. I'm running long on this lecture and I want it to be able to upload, but I do want you to know that hepatitis B, C, and D are all bloodborne pathogens. Hepatitis A is transmitted through the fecal-oral route from contaminated food or water. Hepatitis affects the liver. It specifically can affect the hepatocytes, and people can become carriers of hepatitis and can transmit this to other people. So again, hepatitis affects the liver. It affects the cells of the liver, the hepatocytes. Our liver will not be able to recycle red blood cells when we have particular types of hepatitis. When this occurs, we are not able to detoxify our body. And if we're unable to break down hemoglobin from the red blood cells, bilirubin can build up and cause what's called jaundice. Jaundice is characterized by yellow skin, mucous membranes that are yellowish. The sclera of the eyes will be yellow. Those are very distinct signs of hepatitis and jaundice that is occurring from hepatitis. You can also have symptoms of abdominal pain, fatigue. You can have fever. You can have nausea or loss of appetite. Vomiting can also occur. There are different symptoms that occur with the different types of hepatitis, but jaundice is really a key sign that can occur when someone is infected with hepatitis. You will find this table in your textbook, and it provides excellent information on the forms of hepatitis A, B, C, D, and E. Also, for extra credit, you can do that bloodborne pathogen lab and get extra credit. It's part 3 lab, and it's on bloodborne pathogens. The best reason to be flossing your teeth is to A, get the food out between the teeth, B, stimulate the gums so they're less likely to bleed and produce a portal of entry into the cardiovascular system for bacteria. C, flossing is overrated. D, remove dental plaque and tartar. Well, flossing is good for a lot of these things. It is not overrated. Flossing is very important and you should be doing it. Yes, you need to get the food out between your teeth. Yes, it can help remove dental plaque and buildup that is occurring on your teeth. It can't remove tartar. You need to go to a dental hygienist to have that removed. But B is the answer for this. It stimulates the gums, so they're less likely to bleed and produce a portal of entry into the cardiovascular system for bacteria. We don't want to cause an increase in infections and inflammation systemically from having poor oral hygiene. We need to brush our teeth and we need to floss our teeth. The answer here is B. We want to reduce the risk of complications. You have diarrhea and abdominal pain 4 hours after eating at a food cart. The cause is most likely A. E. coli, B. Salmonella, C. Staphylococcus aureus, D. Shigellosis. The answer is Staphylococcus aureus. Remember, that's the quicker type of food poisoning that can occur. E. coli and Salmonella both take a longer time to cause an infection to occur, but S. aureus is quicker. The most common cause of travelers' diarrhea is A. E. coli, B. Salmonella, C. Staphylococci, D. Shigellosis. The answer for this is A. E. coli. E. coli is the most common cause of travelers' diarrhea. If an infection occurs from E. coli found in contaminated water, antibiotics could A. cure the diarrhea, B. cause toxins to release. The answer is B. Cause toxins to release. Remember, E. coli is a gram-negative bacteria. It has an endotoxin. Certain types of antibiotics will cause this endotoxin to be released. And when it does, it can cause more systemic things to occur. And it can be fatal. It can cause sepsis. So the answer for this is cause toxins to release, B, and this can be very serious for the individual who has this infection because it can cause additional complications. And that's the end of our digestive system infections, chapter 24.